DBS could evoke past abuses in brain surgery. Is it a possible limit in DBS future application? What is your opinion about that?
The whole deep brain stimulation does evoke memories of past brain surgeries and brain modulations, and in the past we have seen some really bad, morally bad experiments being done. But I think there's a big difference between previous neuromodulation attempts and the ones that we're seeing now. And one important difference is that previously patients were often not not asked to provide informed consent. They didn't consent to their treatment or to their experiments. One more difference between past neurosurgery attempts and current DBS attempts is that deep brain stimulation is reversible, and I think that's really important as well. You can reverse the effects. So I don't think we are heading towards the same kind of misuse or abuse of actual possibilities as in the past. At least not as long as we observe some standard ethical guidelines, like asking for informed consent and having the well-being of the patient or the research subject in mind.
DBS and risk of change in patient's personality and behavior. What are the major ethical issues to point out? What are the questions that need a deeper discussion in your opinion?
It's often said, or the question is raised in the literature, of whether deep brain stimulation might change your identity and or alter your personality or make you less yourself or affect yourself or your personality. I think one issue is that the actual concepts are not really clear. We are really confused by what we mean by identity and personality, and some people, I think, interpret it in a way as if they would become completely somebody else, some different person after deep brain stimulation, and would kind of lose their previous self. I don't think that actually is the case, but we do see some changes in behavior and attitude and impulsivity and things like that. And this does raise ethical issues, for example, like how does the family respond to that? How does the patient himself cope with that? Is there enough psychosocial support for patients to learn to handle these kind of changes and to live with those changes? So I think it also points to the fact that the treatment is not only the electrodes, but also the whole psychosocial support that should be in place to support the patient and his family to cope with all these kind of changes. And I think in extreme cases you might have issues of responsibility. I mean, if a person would become really aggressive and impulsive after deep brain stimulation, then you could ask, who is to blame for that? Can you blame the patient for being more aggressive and probably beating up his wife or something like that? Or should you blame the physicians for not finding the proper settings? Or should you blame the DBS system? Or how should you go about that? And that's both an ethical and a legal issue, I think.
In your opinion, is there the risk that non-medical interest could influence DBS spreading?
Well, if you mean by non-medical interests, you might mean like financial interests of companies or the scientific interest of researchers, and I think both of these might influence the development of DBS and the kind of research projects that are being done. Maybe you also mean whether DBS should evolve in non-medical directions for non-medical applications. And there are some case reports that DBS might improve memory or change mood of people. There are also some experiments being done with DBS for things like aggression and addiction. So you could start to use deep brain stimulation, in theory at least, for purposes that are not strictly therapeutic, strictly medical. And then you are speaking about human enhancement purposes. I actually don't think that there's a a big chance of DBS being used for those kind of purposes, because it is an invasive and kind of risky procedure, and you always need neurosurgeons and psychiatrists and neurologists to perform the actual treatment or procedure, and I don't think they will be very willing to do things like that.